I think that one of the most important discussions that I have with young survivors is the fertility issues. And that is usually something that is not being discussed, unfortunately, by every physician that is seeing a patient. The reason that we need to discuss that is, as you know, many of the young patients will have to be exposed in some way to chemotherapy agents. And although not everybody that receives chemotherapy will have the problem of not having babies later on, about 15 to 20% of the patients that receive the chemotherapy drugs that we use today for breast cancer will not be able. So it's extremely important for those patients to be sent and evaluated by fertility clinics. We have a UAB fertility team, and we usually they usually see the patient relatively quickly, and then what they do is they sit with the patient and the husband, and they discuss, or even if it's not a husband, if the patient is still single, discuss the different options that are available to be sure that the patients after therapy will be able to have babies. In younger patients, I think that the fertility issues are extremely important. Number two, sexuality is extremely important for young patients. Not only for those patients that are single and that they are in the process of finding a partner in their lives, but for those patients that already have a partner in their life. And that's a very critical point, because sexuality is so important in the life of a younger patient. You know, one of the most important things, and as the guy that was talking early on about the main issues, is the opportunity for the patients and their partners to have discussion about the subject. Sometimes it's a very picky subject for younger patients, and sometimes because their relations are starting or because they are planning to start in the future, that just because of that is not being discussed. And that's something that we as a physician need to stimulate. Number two, open the discussion and allow both to talk will allow the patient to find the best way to go in order to have a normal sexuality while they are going through therapy for breast cancer. The other important issue that is extremely important in younger patients is the way that the patient will look. And that means the involvement very early on of plastic surgery. Just to talk about reconstruction, you know, is one of the most difficult issues for younger patients not to have a breast. So reconstruction needs to be discussed from the beginning, so the patient will have the option of seeing a plastic surgeon and see the different options that we have for reconstruction. Have a timing, because that's something that is important, time in the middle of the treatment. And that's also another issue that is not discussed. As I presented this morning, you know, when you are young and you are being diagnosed with breast cancer, usually when you see your physician, the tendency is you have to do your treatment tomorrow, you have to go surgery yesterday. And those kinds of things don't allow the patient to think about the issue of reconstruction. So patients have time between the time that they were diagnosed to the time that they will start treatment. They have time to talk about sexuality, to talk about fertility, to talk about reconstruction, how they are going to look after therapy. As I always say, the most important part for patients is never rush yourself into any treatment without having instructions or without having information. Information will give patients and families power to make the right decisions, the proper decisions, to get the best way to be cured. So never rush yourself into a treatment without documented, having information, learn about the options. You have time.